Our panel discussion. It is titled Beyond Technical Measures of Accuracy, Involving Communities in the Evaluation of AI Solutions. I'm Dr. Aishwarya. I'm a senior resident here at NIMHANS. I'll be co-moderating this session along with Mr. Shubham, a PhD scholar from IIT Kharagpur. This discussion brings together voices from mental health, also computer science, public health, and we hope to explore ways in which we can go beyond numbers, beyond just technical measures, and see how we can actually serve communities that are meant to be served by AI. So our panelists today are Dr. Sunayana Sitaram. She's a principal researcher at Microsoft Research India, and ma'am's work in multilingual NLP and responsible AI has led to landmark data sets like Updesh and Pariksha. Dr. Monojit will be joining us online. He's a professor of NLP at MBZ UAI Abu Dhabi, and he's also a researcher at Microsoft, former researcher at Microsoft Research India. And his expertise lies in cross-cultural competence, which is something we spoke about in his seminar and also something we hope to explore in this session. Professor Prabha Chandra, Senior Professor of Psychiatry at NIMHANS and President of the International Association of Women's Mental Health. She has led several co-designed mental health interventions in the community in collaboration with UNICEF and Johns Hopkins. Dr. Sachin, public health and family physician who leads community-driven mental health programs with Ekjut in Jharkhand and also collaborates with UCL on adolescent mental health. So I welcome all of our esteemed panelists. And what we hope to talk about, like I mentioned before, is that many a times when we talk about evaluation in AI, not that I'm an expert in that, but ma'am's session has shed some light on how AI systems can be evaluated. A lot of the times we use accuracy and precision, etc. But when AI interacts with people, we hope that we look at other outcomes like whether it's honest, whether it's transparent, whether it's helpful, safe, and even inclusive, especially in a diverse setting like ours. So hopefully we can discuss how we can measure some of these outputs, and we have experts in all kinds of fields who can put in their thoughts on that. And also we want to see how we can benefit communities and not just developers. So hopefully we can talk about that. So I'll give the first part to Mr. Shubha.
Yeah. So to start off this discussion, we start off with a very simple yet thoughtful question. So how do we actually evaluate these AI models? Is typically using accuracy, AUC-RSC scores, F1 scores, like that. But how do we include these communities, or how can we briefly explain the non-technical participant? And how do we fall short in including these communities on evaluating these AI models? So
yeah, yes. So you're absolutely right that some of the metrics that we traditionally use for evaluating AI models, like you mentioned the different metrics, those don't capture the richness of either the AI output or the interaction that is going on between the AI and the humans, which we need to measure, right? And so, of course, the gold standard has always been seen as doing human evaluation, where a human looks at the output of the system, is given certain rubrics or is given certain things to consider while grading the answer, and then the human basically essentially gives some sort of score, and then that is done across maybe multiple humans look at it. You can have measures of how well they agree, looking at inter-annotator agreement and so on, right? So that has been done to a certain extent from the beginning. The problem is that it is seen as being extremely expensive and also slow to involve humans in the evaluation process, right? So you have to pay them, obviously, if you're getting work done by them, and the turnaround time may be high, etc. So because of that, human evaluation is seen as being inefficient way of doing evaluation. And these other techniques of using standard benchmarks or using LLMs as proxies for humans, essentially, which is the LLM judge paradigm, etc. Right? Those are the ones that have become popular. In human evaluation itself also, the trend has been to go towards this notion of crowdsourcing, where there are paid workers whose only job is to do these data work kind of tasks, right?
Data annotation.
And data annotation. And so they may not be representative of the communities that we are targeting. And so even if we do human evaluation as it is done today, typically, it may be, first of all, there may be people only from certain regions of the world. So for example, one of the very popular data annotation platforms is called Amazon Mechanical Turk. And there for some time, I don't know what the situation is now, but only people residing in the US were allowed to, be part of that, right? So although, you would get good language coverage, for example, because you do have speakers of multiple languages in the US, they still may not be the target community that you really want to be having a say in your process. So even though there is human evaluation in the form of the annotation practices that are carried out today, those also may need to be modified in order to really get at the community level participation, right? So that is the situation right now. We are taking very sort of conscious efforts to try and involve the community more. So for example, the work that I mentioned earlier with Karya, where Karya has a better reach in terms of the people that work on their platform, right? Even there, it's not perfect. It may not be completely representative. It may not really represent the end user that we are targeting, but it is a little better than maybe like a crowdsourced platform. We are doing all of those things. The problem is always speed and scale, like how quickly we can do this. AI also changes very rapidly. Technologies evolve. We want to, have very quick feedback loops, etc. So those are the, speed and scale are usually the challenges for us.
Yeah, so you talked about LLM as a judge. So how do we evaluate the scores? I mean, the faithfulness or the helpfulness of these LLMs using as a judge?
Yeah, so LLMs as judge can basically be given any kind of rubric, right? So if you want them to evaluate for helpfulness, you can basically
For
describe.
helpfulness, this is a subjective term.
Right. So
Depends.
as Monojit said, you're relying on the subjectivity or the knowledge of the LLM to make that judgment, whether this was helpful or not, which doesn't always work.
So, given the work of your previous works, including in Pariksha, so you evaluated AI models on these multilingual and multicultural diversified data sets.
Right.
So, what are the main challenges you got in developing these or evaluating these AI models using those multilingual and multicultural diverse data sets?
Yeah, so I mean, speed and scale, of course, is one problem, right? There is only so much we can cover. So if we want to cover many languages, many domains, many kinds of questions, many kinds of tasks, etc., we are always limited by, how many data points we can gather, and also how many we can get evaluated by the humans, right? There's always a limit on that. And also like just the limits on how many models we can evaluate and so on. That is there. But I think more importantly, in the Pariksha work at least, the questions were not coming from end users who had some stake in the application, right? So ideally, you want it to come from people who are actually interested in asking those questions, right? The ideal situation is they are doing their work, like they're going about their day, they ask a question to the model, and they really want to know the answer to that question, or they're doing some work and they use the model in their workflow, and that is used as the evaluation question because that is very representative of what someone actually wants to ask the system, right? So until you get that, everything else is just a proxy for what the users really want to know from the system. So that is one challenge. Second challenge is, of course, what's the ground truth, right? Like what is the ideal answer for any of these questions, right? That is always a difficult thing to come up with.
Right. So, Professor Monojit, we wanted to ask you. So, a lot of the times when we talk about evaluation, we talk about technical terms, but especially in psychiatry and therapeutic conversations, they're very open-ended. I think you've also published works sir, on how some of the AI systems lack nuance, and that makes them very culturally dull. So, I wanted to know your perspective on how we can, how this fits in there. How do we actually do evaluation when it's so open and so nuanced?
So AI systems, in some sense, are I mean, there are these two extremes. One is if you have a very specific evaluation question, then it is much easier to build automatic evaluation. Uh, on the other hand, especially if you have reference data. Now, in the past, that's how we have been doing it. Now, LLM as a judge kind of changes this whole paradigm because you are just assuming that the LLM will have the ability to uh, really sort of give a judgment on very complex things, very nuanced things. And you can, of course, steer it towards understanding or answering those kind of things better with prompting, like Sunayana was referring to. But then the observation is they work very well some places and they don't work very well in some places. And I think the question would be then what to do when they don't work. Now, my first suggestion, thing would be okay. So before that, we have to also differentiate between evaluation of a model versus evaluation of a system. Model is more like, okay, an LLM, and does it understand culture? Does it understand language and so on, which is very important to evaluate. But that is very different from evaluating a system, let's say an LLM therapist, where we are trying to understand whether it is effective in this specific application. And I think when you are evaluating a system, at least one evaluation, it could be the very last evaluation, has to be with real users. There is no way of getting rid of that step. Everything else is a proxy, but at least one. So that's why HCI, human computer interaction researchers uh, who are more trained on how to do user-based evaluation, is something I think we have to do more and more in the AI space, especially while building system. But until that stage, you can always do proxy evaluations. And these proxy evaluations can be on many things like LLM as judge being one. And there, I think one promising direction I see, which is less explored, is building smaller LLMs, which can actually be just an expert on judging a particular aspect of evaluation, because those systems will be cheaper to run, but also more controllable in the sense of what kind of output they give, what kind of data they are trained on, and things like that. And of course, there is this gap also between, so LLM training so far is very limited to certain groups of people and certain organizations, simply because of the availability of compute and the availability of the know-how. One part that is required for democratization would be uh, how anybody can, with their limited data or something, quickly train a model or build something. Right now, people, I don't know, most of the training sessions I have been to, or myself have been, part of as a trainer, we talk mostly about how can you use few shot prompting or different ways of prompting to quickly build something, because everything else requires more coding. But if there are platforms which are built where you can quickly build and benchmark one LLM evaluator for a specific task, that will be very useful. Having said that, all these would require data. You can't do it without the ground truth data that you have to collect from some source. What I really don't endorse, and this is happening a lot these days, is synthetic data based, and then it becomes a circular problem. You are using a big LLM to generate data, and then on that data train a small LLM, and then use that to evaluate. That is a vicious cycle, I think. And some of the results that we saw in culture space point to that. So it clearly shows that the smaller models are probably learning either because of distillation, or because this process is called distillation when you learn a smaller model from a larger model. So either because of that, or because of maybe just they have limited capacity, we see they get more and more they lose the diversity and become more and more biased, stereotypical responses. And therefore, that's a danger. So I think if we can collect human actual user data and then build LLMs, specifically LLM as judge on that data, it will take us a long way.
Great. Thank you, sir. I think sirs emphasized the the need for a human expert, the human in that process, to kind of make that more rich, more nuanced. And Prabha ma'am, you've worked so much with communities and designing mental health interventions for communities in your work. You've also begun to explore how AI could be used for data capture in certain communities where you're working with UNICEF and John Hopkins. So, can you tell us about why community involvement is so essential at every stage of planning and how you've gone about that?
Yeah, good question. I think when we talk about community, there are two groups. One are the users, that is people who you are evaluating. Also the evaluators themselves, So if you are looking at community-based mental health, for example, because that's my experience, you have the ASHAs, the ANMs who are collecting the data, right? And like we just heard, whatever you feed into the whole data set is what you will get. So how are these people actually collecting the data? And they are also your people with lived experience in that sense, because they are the ones who are going to give you this data, particularly in mental health, which involves more interview questionnaires kind of thing, and I'll just come to a few examples. The second is, of course, the end user. In my case, the kind of work I do, I work with young mothers or older mothers, basically mothers who are having children and pregnancy and postpartum, etc. So that's my space. These are women who come to a facility, and the only way that you can capture whether they are depressed or anxious is for somebody to ask them these questions, right? So the responses that we get depend on 100 things. So if we are talking about AI being contextual and cultural, even the responses that the users give depend on so many aspects, the privacy that they have in that place, the kind of questions we are asking, the language we are using, and most importantly, the options we are giving. So for example, in places like rural Telangana, rural Jabalpur, the scale models don't work at all. Like our, regular scale models that we use in questionnaires, where we're asking, is it most days of the week and most times of the month, and, all of those. People in India, majority of them, even urban people, don't think in terms of scales. They are not able to sort of conceptualize scales. So I think that there is probably a need to look at in what way do they quantify their distress? Do they say, so do they think in weekly terms? Or do they think in a sort of more a different kind of a conceptual? So what I'm trying to say is that when we try to capture this and validate it with like a more interview conversational style, we get completely different responses. And I think we really need to be aware of that. And so any LLM thing that we feed data in has to actually gather the data properly, So we then went from the classic questionnaire model to a ultra short tool, which is like only 2 questions, and then trying to give visual methods of, quantification of severity and frequency, which somehow seem to be more intuitively more acceptable to a lot of people, rather than looking at something very conceptualizing once a week and keeping that in mind for all the 10 questions that you're asking. It's a nightmare, nightmare for the person who's doing it. And then ultimately they keep saying, kuch nahi, kuch nahi, kuch nahi, kuch nahi, So, and then imagine that kind of data is going into a LLM and, making something out of it. So I think it's extremely important for us, whichever context we are looking at, is to capture data meaningfully. And that is what is something that I'm sort of working with a few organizations, trying to see how we can do that. One of the other problems with mental health is it's all assessments which is done by somebody else, particularly in low literacy situations. It is not unlike in the US or the UK, where every woman who comes into a clinic is given a questionnaire and she ticks it herself. and gives it, and the response gets gathered. Here, it's not like that. You have to ask that question. Somebody has to ask that question. And there is a lot which is lost in translation, because how you ask, what you ask actually determines the responses. So we are trying to see whether we can, even for these rural areas, whether we can develop a kiosk model, where you have like an avatar or a mascot or somebody asking the women these questions, so that they are responding on their own without a human interface, so that we get more relevant and valid responses. So, and that might be a good way of capturing data, where nobody's asking you, but it's like something that you are responding to. And particularly for low literacy populations, I think it's a huge challenge how you capture data. So that's point A, capturing data from the end user to the person who's evaluating. The second challenge is taking that data which the evaluator is using and putting it into the LLM. Let me give you a simple example. Blood pressure, weight, hemoglobin. Okay, if you look at the ways in which it was being done maybe a year or more than a year ago, all women will be 45 kgs, all blood pressure will be 120/80, and all hemoglobin will be 12. Now, the reason why this happened was that anything more or less, they have to refer, or they have to spend time. The ANM, the ASHA, has to spend time. So for them, dekh rahe hain, theek hai, yeah, she looks fine, move on. So, and this is true. So when they actually started, feeding this data into models, trying to understand predictive models, etc., they found that the data capture was like, this is not possible. They were getting all these ceiling effects where, I think it's called heaping. Yeah. So everything was heaped at one end and there was nothing at the other end, which seems very improbable in India. So now what they started doing is everything has a Bluetooth. Okay, so the BP apparatus has a Bluetooth. The point anemia has a Bluetooth. The weighing machine, of course, we know easily can be done through Bluetooth. So everywhere they are using Bluetooth so that correct data is captured, and I think these kind of innovations are important for the kind of model. So I'm trying to figure out what can be that thing we can do for mental health, So can it be something which is voice activated data goes into the app? So the ANMs, for example, have an app all over India called the Arman app, which is actually part of the app, their phone. So all this data goes in. So when a woman is asked, how have you been feeling, or have you been feeling depressed? If she says, thoda bahut, kabhi kabhi, how will that data be captured through her voice and go into that app? Because otherwise the ANMs are going to say 0, which is what we are finding everywhere. Kuch nahi hai, no problem, nobody has depression, nobody has anxiety. So I think these are the issues in the field where we really need to figure out what kind of data we are capturing and actually focus much more on the quality of data. Make it, I mean, though the human thing has to be there, but the person who's taking that data and putting it into the model, needs to be honest, truthful, needs to understand the value of that model. The only place that AI has been able to help us in the antenatals is when women are not coming for antenatal checkup. It's able to kind of predict, this is a woman who may not come for her second and third, based on certain characteristics. But those characteristics are the more objective ones. For example, it doesn't capture violence in the family, so it doesn't capture a past neonatal death, for example. So what I'm saying is, when we are looking at nuanced data capture, we really need to think of all these things, because whatever we feed is what we are going to get. Yeah, I'm going to stop here.
Yeah, thank you so much, ma'am. That was really insightful. I think yesterday also Sanjeev Jain sir and VB sir in their panel said it's not just about who the person is, it's also about who's asking the questions, and that's precisely it. The way that the field worker is interpreting the data and then entering it also, of course, makes a huge difference to the quality of the data set at the end of the day. And I think ma'am has also highlighted the importance of the user being part of the system directly in a way. Like, just ensuring that whatever the data is, it goes as is into the system. And that actually, brings me to this segue here with Dr. Sachin, I think, sir, you work so much with communities. You've talked about how you even work with, particular language in that community and how you've helped them with their interventions. It's so difficult because people in the community sometimes may not know English, may not know the technical aspects of AI. So how do we actually incorporate the end user into the system then and use them for evaluating AI systems, which are meant for them? So how do we do that in your experience?
Thank you. And I will like to continue with what Dr. Prabha ma'am said right now, because it's very important that what we are seeing in the community. I am coming from Jharkhand, and where we are working is an aspirational district, and with around 2 million population, and most of the migrations happening is to the Bangalore and South Indian cities, and this is an aspirational migration. It is not a migration for food, but aspirational migration mostly for the mobiles, vehicles, gadi, and clothes and all these things. And there is a one terminology in technology called leapfrogging. So the technology is moving very fast to the interior villages. So they have mobile, they have all these things, but with that, the restrictions, the regulations are so relaxed at their community that the harm that they are getting due to this community is more than the youth in the urban area or in the other areas. So that is very important. So that's why we now we are talking about AI. And when I just before coming here, I talk with our youth facilitators who are working with young population, and I just ask them, are young people are using AI or not? So they say yes, they are using. Those who are college going, they are using. They are talking with them in the Hindi language, and it is like audio talking. So in terms of mental health also, when we started working on mental health, it is very much important what are the terminals, so what tools we are using. So it is not just a translation from one language to another language, because it will not capture the essence of the data. And who are the facilitators, who are the interviewers, that is also very much important, that if I will ask the questions, he may not agree. And as Dr. Prabha says, the concept of severity, frequency, 2 weeks. So like in PHQ questions, which are for the depressions, there is only one in last 2 weeks how you feel. But here we modify that in every words. 2 weeks is very difficult concept. So last 15 दिन में हर सवाल के पीछे last 15 दिन में we have to ask. Severity in depression. So option also कि last 4-5 days. So we have to use the glass picture कि पूरा भरा हुआ है, आधा भरा हुआ है, कितना भरा हुआ है. So it is very important to capture the correct data. And the languages in terms of this, what are the idioms of distress, because this mental health is also so much stigmatized that people don't want to share the things. And so it is very much important that they should be able to trust you, and they should also able to find the connections with that questions. So that one thing is I really like to mention here. And regarding in terms of evaluation, when we talk about the evaluations, so there are, so in a public health, we are doing large scale evaluations for maternal child health, postpartum depression in Jharkhand. So in evaluations also, the qualitative part is very much important. Ki what data is coming through that evaluation process, what are the things. So during our large scale scale up, we found out that there are certain regions where the intervention is not working. So during that evaluation rate captured. Why? Because the literacy level is so low that our manuals are not good there. So it is a particularly vulnerable tribal group. So we have to remodel our manuals, more pictorial manuals we have to find. So these things are very much important in terms of the evaluation. So this AI is new for our field, but it is entering quite fast. So we have to think of this in terms of safety, ethics, and evaluation parts in future.
Absolutely. I think I have limited experience in this, but
Yes.
during my MD thesis, I had to evaluate women with bipolar disorder. And a lot of the times, because I come with my own hypothesis in my mind, I would evaluate them for sexual dysfunction, and they would have high scores on certain things. Then I had to administer a sexual distress scale. And surprisingly, they all said, no, that I have no distress. I kept asking, you don't have any distress? Because I thought that they would. I had to then discuss with my thesis guide about, my own way of evaluating and how we can, tailor that. So I think this is important in that sense. Ma'am, do you think community intervention, community evaluation and participation, is it common practice to, have in AI systems evaluation today? And if not, then why not? How could we, maybe work towards that?
Yeah, I think it is very, very uncommon right now, although some people are trying to make efforts. So, for example, this other organization that I mentioned called Collective Intelligence Project in the US. So they have done some kind of community, not exactly evaluations, but what they have done is they have tried to get preferences from the community and then distill those down into certain policies that can then be put into the models, right? So, for example, what the tone of the model should sound like, or what kinds of ethical rules it should follow when it is trying to solve a dilemma and things like that. Instead of typically the way it is done is the team that is building the model, right, decides all these things, right? And yes, in some larger teams, they may have some interdisciplinary collaborations. They may have people from the social sciences or ethics disciplines and all who can help with that. But more often than not, it may just be people who have no training at all in those disciplines, just taking those decisions, right? So here, what they tried to do was improve that situation a little bit by trying to float surveys to a large number of people, then trying to distill whatever feedback they got from people. And then, of course, it has to be in a way that can be consumed by the AI model also. So they did that. And then this was actually work that they did with Anthropic, which is a large model provider which builds the cloud models and so on. So there is, there have been some work like that. And of course, our work where we are trying to work with Karya workers, trying to involve them for the first time with this kind of evaluation. There has, of course, been a lot of work on trying to collect data from communities, from specific communities. So, Monojit and Kalika have worked a lot on, specific linguistic communities in India. So, for example, Gondi, Mundari, and Maithili, and so on, right? To build language technologies that are actually useful for those communities. So, trying to ask the communities themselves what they need, and then build those specific technologies for them, or trying to collect data from them, and so on. All of that we have done. In the LLM world, that is very rare. It's been done in small bits and pieces here and there, and there is a lot of I would say, like, people really want to do it. The biggest problem is just the pace at which things are moving, right? Everybody is in this race to create the next best model and the next best data set and so on. And because it has to happen at such a fast speed, all of these things which require a lot of time, care, energy, people, persistence, all of those become, they don't become the main thing, but they become like something that is done on the side, right? And I think until we figure out how these can scale better, or how they can be integrated into the regular model building process itself, the situation is not going to change much.
Yeah, so following up with the Dr. Monojit Chaudhary, so how can we, as a developer, how can we embed these co-design voices or co-design method of the developers and the communities? So how do we embed these co-design voices of the communities into the language models? And how do we evaluate further more touchfulness, to bring more touchfulness to the AI models?
Before answering that question directly, I wanted to quickly mention, two comments based on mostly what Dr. Prabha and Dr. Ashish said earlier. So one issue of where and how, who is the interviewer, right? And can AI be the interviewer? That also depends on what kind of trust people have on the interviewer. And it's very interesting to see that in people who are already savvy digitally and use, are literate, use phones, smartphones, and so on, they have chosen ChatGPT kind of platforms to share their mental distress or other issues more readily because they know that, okay, it's a private space and they open up. So it can be a great, in some sense, way to collect more data. But on the other hand, the communities you too were referring to, it's not the case because clearly they are not users of technology and all that. Now, should we build an AI system for them? Or even if we build an AI system, what should be the tone of the AI system? And all this becomes very important. And one interesting anecdote that I recently heard is in Uganda, apparently. So there's an organization who helps with mental health issues of teenagers and young adults, especially women. And the best person they have found who can help them, open up is the grandmoms in the family.
Friendship bench, it's called.
Yeah. Okay. So they actually are working with the grandmothers and building a community of it and all. So and in fact, in India, like if there are best practices, who would people want to listen from? And the funny answer that I mean I was telling in Dutch tool was maybe the spiritual gurus. Like if they say something, like people believe them more than doctors, if you see the masses, or maybe the political leaders. So, but jokes apart, that's the point. Where do you put your trust? And if you want AI to come into this whole ecosystem, then it will be important to make sure that the AI is not perceived as an intruder or an outsider, and it's a very natural process, and people naturally build that trust. How, I don't have an answer. Like it's like people who work with the ground in the ground, and also there has to be trial and error for sure. We are not going to be right in the first uh, occasion. The other thing is AI can help in broadly three different ways. So one, which is the most easy way, is scaling up things. But then AI can also help as a efficiency thing, not scaling up in the sense of going to the users or all that, but in the backend process, it can make things more efficient. Or the third, which is the most sophisticated use of AI, and something which I was also alluding to in my talk, is more like a brainstorming partner. And I think the brainstorming partner comes much later. It's the first two usage, like scaling up and backend efficiency. And of the two things, I think the backend efficiency is a sweet spot because it's a high gain, low risk situation because there is always human in the loop. And you are just trying to help the humans do their jobs fast. So for instance, ASHA workers, can they be benefited by AI instead of AI being the interviewer directly? Because AI being the interviewer will have a lot more, will require a lot more testing, thinking, and trust building. Yeah. So that's a good segue also to the question you were asking about getting the communities involved. Um, as such, there are a lot of success stories and there are a lot of models of how communities can be involved in. I'm sure in your area also there will be such models, but I come from more the language and human computer interaction side of things, and there are these standard models of co-designing technology through focus groups, through various other there's this Finland model of working with the whole city to plan the city and things like that. So there are these standard models, and we have tried many of these things when we were doing, working on languages like Gondi or Mundari. But and the good point was, as a technologist, when I go and start these workshops, we often end up with a lot of surprises and deep insights, because what we think where technology might help and where actually people want help is very, very different. I can share two very quick examples. So in case of Mundari, we were working with two linguists from IIT Kharagpur, and these languages are spoken in and around Kharagpur area. Much broader, but we are looking at communities, villages in and around Kharagpur. And we got them in a room with us and linguists and to discuss. And they all spoke Bengali. So the language of communication there was Bengali. People got comfortable very quickly. And we had adults, young kids, a mix of people. And we asked them, where do you think technology can help? And their concern was, I don't want a translator. I don't want a speech recognition system for Mundari. These things are not what we need. We need some games in Mundari. Why games in Mundari? Because kids don't like learning Mundari. They are already learning, Bengali and Hindi, and there is economic benefits of it. So our language is dying. Can you design some interesting games to teach kids the language? And of course, that did not require much of AI. That was more a different kind of technology. We ended up doing something for them, although we didn't do a longitudinal study to see how it helped. Gondi, on the other hand, was a very different case because it was the case of, people who didn't read or write, didn't use much technology. They were in the forests. And for them, it was this NGO called CG Netswara, with whom we were working. And for a very long time, we did not even directly interact with the speakers of the community. So most of our interactions were with this NGO and the people, and they have a group of people whom they call editors. What the editors do is, so there's a community radio sort of thing, a mobile-based community radio, where they will call and talk about whatever they want to in their language. It could be problems they are facing. It could be requests to the government about policies. It could be just sharing a good news, something. It's like a Twitter, but all on just phone and voice based. And then the editors have to classify them in a way so that it is searchable. Because you might again ring back and say, I want to hear about this area or this kind of events, or what are the top 10 complaints that came up yesterday. So you have to tag them. And they wanted an automated system for tagging them. And it was a very different use case from that of Mundari. Although in terms of health, vitality and all of the language, the two communities has very similar prognosis. The linguistic communities have very similar prognosis. But because of the other factors, the things were very different. And that's the benefit of involving the communities from the very beginning. The only concern I saw in the process was in case of Gondi, for instance. Often, of course, it's not a complaint specifically about CG Netswara because they were really, they are doing an excellent job. But I have heard in other cases, there is often this chance of, these middlemen, if I call this NGO the middlemen, running their own agenda because we are not directly talking to the end user. So we might miss actually what the end user wants, and the middlemen might have their own agenda, which is not necessarily bad, but also may not be truly reflective of the situation. So that's something we should be aware of.
Yeah, so coming back to this more technical aspect. So what are how can we embed this? How can we prepare the data set of this multicultural domain? How can we include these culturals into a large language model or a specific small language models? So how can we include this as the data sets are coming from weird societies like the Western culture? So how can we include this data set, and how can we prepare this data set to include those multicultural and multi-domain scenarios towards more like a Indian or a global South?
Yeah. So there are two things here. One is if you see the mainstream cultures in India, let's say, let me call it the Bollywood, cricket, and Hindi culture, that triangle. Whoever falls, we all have some identity there, right? Some shares there. So that particular culture, it's not true that there is a dearth of data. I think there is a lot of data out there. The models get biased for a very different reason because these are statistical models. So if, let's say, I have 1 million data points from these cultures, which is a lot, but then it was trained on 1 billion data point from the Western culture. So then the skew is huge, right? 1:1,000. And as a result, the model's behavior gets more towards, steered towards the other thing. And this is very clear. Like I'm here in France, in Spain, Madrid right now. Tomorrow, a conference is starting where we have Sunayana and I have a joint paper where we show exactly this, that it's not that, let's say, models do not know what festival is celebrated in Kerala in a particular caste during the wedding, or what is a particular death ritual in a particular Buddhist community. So often models have this knowledge, but if you ask it to generally paint a picture of what is a death ritual in India, it will go with a majority like typical Hindu upper caste death rituals. Now, that's more a problem of how these models are used rather than the data and how these models learn from data. So that's a problem technologies have to solve, not a data problem. However, when you go to more specific things, yes, the data narrows, tapers off quite often, I mean, quite quickly. And there, there is this trade-off between richness of the data that you collect and the scale. If you really want to collect very rich data, you can't go large scale. And if you collect large scale data, then it has to be very shallow. Um, my understanding, and here I don't know what you think, Sunayana, my understanding is, or belief is that it is better to collect very good rich data sets, because eventually models will be able to learn and generalize from them, even if it is small, rather than collecting shallow data sets over large population. Examples of that would be like the World Value Survey. So World Value Survey right now people are using a lot, but I think it's a very shallow data set. It just asks 300 questions to get a value system. And of course, it is over 60 countries and 10,000 users and blah, blah. But it will only take us so far. But eventually, these rich data sets will be more useful in the future.
Yeah. Yeah. So, I mean, I completely agree, Monojit. I think the problem we are facing is that the trend is towards, big everything, right? So big data and large compute and larger models and so on. And so it's become very difficult to challenge that narrative, I think, of just, making everything as big as possible. The second also is that somehow data should be free. We shouldn't have to actually pay for it, or we shouldn't have to, make data collection an actual effort. Like whatever is there on the web, we should just scrape that, and that is the data that we have, right? And any other data that needs to be collected can be generated by the model itself. So that is the synthetic data, right? So in a sense, it's all free, that you get data for free, and spending time and money on data is still looked at as a, oh my god, like a expense, whereas compute is not the case. Is not the same with compute, right? Compute you can spend lots and lots of money on, buy super expensive GPUs, and that is seen as being very normal, right? So that I think has to change in a way where we normalize spending time and effort and money on data collection as much as we are on compute, because in a lot of cases it's been shown that actually it's better to have, as Monojit was saying, right, like better data, richer quality data, even if it is smaller, compared to just scaling up in terms of compute. So that, I think that is one other concern that is there, is that the data that is there, at least on the web, is all over now. It's already consumed by the models, right? So where is this new data going to come from? How are we actually going to collect it? In what form? And who will it be available to, etc. So that is also a consideration.
Ma'am, Prabha ma'am, I think we discussed about how communities need to be involved, and there is a consensus that they should be. In the preceding days, we've actually talked about, safety, privacy, and whether the end user even wants to be part of it or not. How do you see that, in the community setting and data collection per se? How do you see that being a problem?
Yeah, I think we've been using the word trust quite a bit for the last few days, and I think that's key. I think unless community trusts the person who's gathering the data, I think it's going to be a little bit of a challenge, because there are lots of concerns right now about data privacy, and rightly so. So I think that's something, like, whenever we are doing this work, or as we are embarking in creating this method by which we can use AI to capture better data on whatever, or use on transcripts, or I mean, we are using it for so many things right now, like medical record notes. We are scanning them and using them to generate data. Now, again, trusting that data cannot be traced back to somebody. I mean, there are so many things that we need to, or to even regions. And so I think we need really much more public education, I feel, on creating trust about what giving your data or means for the service of humankind. I think that's so. If you want to scale up something so much, we really need to look much bigger. Though I agree with Dr. Monojit that depth is important, but I also think that overall, I don't think the public right now is fully aware of what it really means to that this data is captured, how is it used, what can AI do for them. I don't. It's all of us who are providers who are very excited about this. I think that the users, of course, the younger generation, the sort of people who use the ChatGPT as a therapist, we see them so much now, so that generation, yes, probably for stigma, whatever, ease of access, 1:30 a.m. at night, using. I mean, I got a message last night at 1:30 a.m. Ma'am, may I talk to you? I'm distressed. So obviously I didn't see this message, and I'm sure this person would have gone to ChatGPT and said, because at 1:30 a.m. no doctor is available. It's ChatGPT which is available. So I think it is going to increase, and we need to accept it. But I think developing trust is very important. What Dr. Monojit mentioned about the things like the guru and things like that, it's very interesting that we were developing a chatbot for mental health problems, which was not so much AI, not the classic AI. I mean, it was usually, we had put data for a lot of very FAQ kind of things, and it would generate responses. And in every community, the face they wanted was different. These were women who were facing violence, or in difficult circumstances, but the kind of face they wanted was different. It was usually a woman, a middle-aged woman that they liked. The names were very different. What the names mean were very different. So some places wanted like Shakti Didi, some people wanted Shakti Auntie, another place wanted Geeta Ma, another place wanted a bindi, one place didn't want a bindi. I mean, the kind of things we got was so rich that you wouldn't think that you'll get so much, because usually it's we sit here and we make a face, or we decide how it should be, and we got a whole range of responses. So I'm just giving these two examples. One is that people are going to be using in the middle of the night AI systems for support, for mental health support. We have to accept it. So developing trust in the public and getting much more data will be very important. And I think, like Dr. Sunayana said, this thing of data should be freely available, is also a bit of a challenge. I mean, everybody spends money to get certain kinds of data. You have human resource, it's human intensive also. And I think we need to acknowledge that some amount of, money should be spent, funds should be spent to gather this data. Only then you'll get good quality data, which you can feed into the LLMs. So I think these are the points that I wanted to make.
Thank you.
Just coming back to the question of data, or the quality of data, which Dr. Monojit was talking about. Yeah, large data is one of the things about large data that I find problematic is large data usually reflects, for instance, the Indian context, when we are talking about, let's say, a general thing. In fact, which Dr. Monojit actually flagged, when you ask a question, generally ask a question, the answer would be usually flagged, if it's a general question, would be based on upper caste, North Indian framework, where a lot of nuances in terms of, including, and since we are talking about mental health, including mental health nuances, which, for instance, is rooted in caste discrimination, is lost in the process. So, I don't know. I also personally think whether how, or rather, my question is how would it be possible to bring this nuances into data collection? Because data collection, you have a set of questions you ask, pass around the set of questions, it's fine. But how do we get the nuances? And I believe it has to be human resource intensive. And also from those communities. Yeah.
So one thing I mean, for language, again, I'm coming from, this is like about building language technologies. I mean, we can always, as technologists or as mental health experts, go and work with communities. But I think it never scales unless the communities themselves come. At least in language, I have seen this. If a linguistic community wants to build something for, or wants something for their community, there is a need, and they are empowered somehow that they can come and voice that need. It works much, much better. So the same would be for data representation, that if the community is empowered to talk about where the models fail, here is where so we are now empowered, like we all in this room are empowered, and we are challenging the weird notion, right, of the West. If there are these other communities which are also empowered, and there is a public knowledge, public education, enough of that, then they can, then there can be a, uh, pull rather than push, in the sense that from technology point, the way we describe it is we are not parachuting a technology that, look, we built a chatbot for you now, henceforth you are going to use this chatbot. Rather, they should come and say, we want this and not that, and this is how it should be. One such great example, at least personally, we came across was this language called Idumishmi, which is spoken in Arunachal. It's a very, very small community, much smaller than Mundari or Gondi. I think there are some 20,000-30,000 people in a village who speak that language. And there are like 4-5 such villages speaking related languages. And they were empowered in the sense that they all spoke English, Hindi, they had PhDs, linguists in their community, and so on. So in that sense, they were empowered. So they knew all the AI thing going on around, and they wanted certain simple things to be built for their language. And they said, we will give the money, we will have the coders and everything, you just give us the expertise. And it was very easy for us. Now, I also see the problem with that model, right? Everybody is not empowered, everybody don't have the know-how. So how to make that would be probably the first step, right? Like how do you empower people? Which is a much, much broader challenge. But public, like Dr. Prabha was saying, like public knowledge and education is the starting point, of course, one of the starting, and economic independence. These two things are probably the cornerstone of that. But yeah, if that happens, then data comes naturally. But if we go and collect data, I think we can only use case studies one after another.
Great. Thank you, sir. Sachin sir, did you have any, key takeaways or something else you wanted to add as we come to, the close? Did you have some other points you wanted to discuss?
So I just also wanted to continue with what Monojit right now says about, he gave the example of the community from Arunachal Pradesh. But what I observed, like you said, Mundari is also widely spoken in Jharkhand. And there are different languages, Santhali, Ho, and socioeconomically the communities have low resources, but in terms of language they are very much prone, and they advocated to include it. They have all the young people who are trained to communicate and to disseminate their languages. And you rightly mentioned ki for education and other things they are using Hindi, English, but for cultural things, songs and all these things, as a cultural preservation, as a cultural identity, that language is very important. And I think that is a good opportunity for technology people, AI, that how to bridge that gap, because the people are already aware of their language.
Another thing you mentioned, I think yesterday, was sometimes the community, they wanted a certain kind of individual to ask the question. You had to actually go back and check that. I think even in therapy, many a times we tell our clients and we tell our patients that you may not always click with the first therapist, but that doesn't mean you stop trying. You try it again. Maybe there'll be a good fit some other time. Maybe AI can bridge that gap as well, because it can kind of adopt personas and adopt cultures, and in that way, I don't know, fit into that context. I don't know how you feel about that.
No, very important. As Manojit, you mentioned about friendship bench. So similar thing, that when we discuss about this distress and mental health issue with our community, with young people, and we ask them ki who is a good person to talk with. So they say ki little bit elder and not much older. So 20 to 30 age groups. And then we have facilitators that age group and community called them as Sukh Dukh Sathi, because they share Sukh Dukh ka baate. So, and when you see in terms of scale up, so if I need to scale up this Sukh Dukh model in large scale, AI certainly can help. AI assist can help, because through AI we can train them, we can skill them. So as a human interface and with AI supported technology, that scale up and that thing can happen quite quickly, I think.
Sunayana ma'am, did you have any final takeaways for our listeners?
Sure. So I think one of the points that we've sort of touched upon, but I just wanted to make it a little more explicit, is all of the models, all of the LLMs and all that we are discussing pretty much have the same architecture. Okay, so there is very little innovation, at least currently, that is being made. The real innovation is in the data, and that means that data has become sort of a moat for everyone, right? Like whoever has more data wins, essentially, or whoever has better data wins. And so when we talk about community involvement and gaining their trust and collecting data, etc., I think we need to, of course, educate the community about how this will benefit and all, but also take a very hard look at who is going to own that data, right? What is the ownership? Does the community own the data? Does the model builder own the data? Does the application builder own the data? Is it ever released for other users, or is it only used by the person who's building the app? Do the community members know what can be done, given that we are in the age of deep fakes and so on, right? Do they know that potentially their data can be used to generate anything? All of those things, I think we need to, we need to have answers to this very clearly. And I know that there's a lot of policy discussion going on around these aspects with the India AI mission and so on. But I think we need very clear guidelines on all this, so that we can then communicate them to the communities and ensure that people who, some communities that may already be marginalized are not further marginalized because of these reasons.
Absolutely. Monojit sir, did you have anything to add as your takeaway, or anything else entirely would do as well? If you had any final thoughts?
I mean, picking on what just Sunayana said, right? I think again, going back to the Dutch tool example when I was there. So one of the thing it seems in the West people have been talking about and right now talking about is these platforms that we can all come together and build for data sharing without I mean, it's not like free data, you pay. So there are different kinds of data. Some will be paid, some will be free, and some will be eyes off data. You cannot see them, but you can, upload a model and somebody can evaluate. And there can be a whole bunch of different, let's say, evaluation schemes which are embedded in those platforms. So Nana, since we were saying what kind of ideas this AI mission can take up, I think that would be very, very useful for India, being so heterogeneous, and mental health itself, or health more broadly, healthcare, right? If we have such platforms, because it's not only the quantity, the quality matters a lot, and the quality is so hard to characterize. So if there is a common platform where people can cross verify, and then trust also builds because it's more transparent. So something of that sort, I think, is definitely needed very soon.
Right. So the India AI mission does have a datasets platform. It is called AI Kosh. So a lot of datasets are uploaded on that, but they don't have the kind of features that Monojit is talking about. It's just essentially uploading a dataset, and then there is some metadata associated with these datasets. So a lot of government datasets, for example, are available on AI Kosh. But yes, I think having a much richer sort of repository with all these different levels of, paid versus non-paid, or even better sort of controls would be good.
Ma'am, I think I'll invite you now to give your final thoughts, because I know how important it is to have even the last person in the queue, be part of the conversation when we talk about AI evaluation and reaping the benefits from all of this. So any final thoughts, ma'am?
Yeah, I think just echoing what everybody has said, that, we need to be very responsible when we are using AI. So which basically means that everybody, we should be as inclusive as possible. Because, we should not use data sets that are developed in a very small, we talk about the weird, but we can be equivalent of weird even in India. It probably needs another acronym, but sort of whatever, urban, educated, something, so I think that we really need to guard against that. In mental health, I would even add only clinical, because there is only a certain percentage of people who actually reach the clinic, and if we use all the data only from the people who actually come to clinics, mental health clinics, we are missing out on a large group of people who are probably seeking help elsewhere, or, or going to other systems of care. So I think we need to be very cautious about that, because then we have to be very responsible. So ensuring that the location, the context, the inclusivity, the gender, the age, like everything is captured adequately is also our responsibility as mental health professionals who are gathering data to inform these AI models for whatever they are providing. So I think that would be my thought.
Absolutely, ma'am. I think collaboration, trust, I think that's two things that I took away from here, because the theme for today was representation, fairness, safety, and that's exactly what all of our experts have kind of talked about. I'll open the floor to any questions online or offline.
Yeah, I'll get it going now. Yeah. Okay, and I will take from where Professor Prabha ended. And I think Monojit would agree with me. Actually, in the current AI applications to mental health, it is the dearth of clinical data rather than the abundance of, or domination of clinical data, because mostly what people are playing with right now, and I mean, I'm using the word loosely, not playing, what people are modeling right now are trying to tag, is this particular tweet or Reddit thread is actually signaling distress. Now, when as a psychiatrist who is interested in AI, when I look at those papers and they achieve excellent F1 scores, etc., I realize that this is toy example, as we say it in computer language, isn't it, Monojit?
No, absolutely, absolutely. I mean, I don't know what to say, because right now we are trying to look at loneliness data sets, and what we are looking at is Reddit. So you just said it. And how people express loneliness and all. And we spent a good 3 to 4 months just brainstorming how to get the data, where to get the data from, because we spoke to a lot of people who are working, I mean, clinics around the world. So one in Israel, then some clinics in US, and now I'm in front of NIMHANS and Tezpur University, sorry, the medical college. And the question is uh, same, right? What are these other sources of data that we can rely on? So Reddit is, of course, a very quick thing. Like somebody like me who suddenly has this interest in mental health, wants to start. That's how most technologists do it. And they try to find something to work with quickly. Actually, one of my colleague, I will also add that. So Professor Irina Gurevich, she's from Germany. She's in NLP world. She's very well known, very prolific researcher. So she was complaining that, oh my God, why I wanted to enter in NLP and mental health. For 1 year, we just spent working on something which is not publishable. And why it is not publishable? Because everybody, I mean, all the reviewers are saying this is toy data. This is like exactly the thing you were saying. So yeah, so that criticism is very valid. And that's why this platform kind of things might help. There are some places like this Israel Bar Ilan University's psychology department. They have some tie-up with some, or maybe they host some clinical, NIMHANS like place where they provide therapy and all. And all patients actually going through therapy sign some agreement, and all therapies are recorded. Some video recorded and some only audio recorded. And then a part of it has been translated to English also. So these are all in Hebrew, so translated. So fortunately, by working with them, we get access to some of this data. Similarly, in Germany, I forgot the name of the university at Trier University, I think Trier University. So their mental health unit was also doing something similar, but they cannot share. Their agreement is such that they cannot share anything outside. So if you want to work, you have to go and sit there and work on their servers. But even that works because if somebody is really keen, they can go and sit there. And we are planning, in fact, Asim might go there and spend some time there, for instance. So these are the models right now, but if we can open it up in some ways, and India can be the leader here, actually. We don't have to wait for the weirds to be the leaders.
I just want to say to Monojit that you won't get the term loneliness in more than 10% of our clinical records because it's not something that is asked commonly. So it's also about what is asked commonly. So you'll probably get loneliness more in Reddit than in a clinical record. So that's so as a result, I think even the questions you ask depends on the kind of data you're capturing.
Hi. So I should have asked these questions earlier, but I'm slow in mind, so I took some time to process it. So, if I want, say, translation in English from a Indian language, so there are languages where there are transcript, and there are languages where there are no transcript. Like there are so many Arunachal languages where there are no transcript, so they are writing in English. So which would be difficulty-wise, which would be difficult because in terms of code switching, code mixing, it would be difficult to pick up for AI in terms of when we are writing in English, those things. So in difficulty-wise, which would be difficult translation-wise?
So there are two things here. One is the fact that the language doesn't have a script, so it doesn't have a writing system. So sometimes it's never written, or sometimes it is written in another script, like in English, right? And the second thing is that the language itself, there's very little representation of that language in any of these models, right? Because it is never written, it's never in the data, in the web data, and so on, right? So if there are such languages, typically there are no translation systems available for those languages, right? Very rarely do you have translation systems available for languages that don't have a script, because then by default you cannot write them, right? Some languages like Konkani, for example, are written in English script, in the Latin script, and some other languages also, and those do have translation systems. So it's a combination. If you have a very low resource language, so something that is that has very little data, does not have a translation system already, and does not have a script also, then that's very a difficult sort of thing. Whereas what you were talking about, code switching and so on, I think for the major Indian languages, code switched with English, the LLMs are able to handle them reasonably well. Or even if you write Hindi in English script, right, and you ask
They also
ChatGPT,
they
it's able to do that. So it's a combination of these different things, right? Like, is it written? Is it low resource? Does it have a translator? Is there enough web data? All of those go into determining what the interaction will be like in those languages.
Just another things that just observation. I don't know whether my hypothesis is correct or not. In Madam's lecture, we get to know that cross-cultural, in terms of cross-culture, LLMs from China, Queen is doing better. And then we get to know from Monojit sir's lecture that actually there are some cross-domain or cross-culture like learning that AI can learn. And China, as we know, has much more greater literature. So is it like this language, this Korean is doing better because it has more rich learning or training has been happened in those languages, something like that?
No, I don't think that's the reason. I think the reason is because the model itself is very good, very powerful. So it doesn't have of course, it has to do with the training data that is used, but it's not necessarily because it is trained on those languages that it is doing better here. And I mean, the differences are not very stark. So it's not that the Chinese models are doing like much better or anything. But what is surprising to us, at least, like, for example, in the health pariksha study, which showed this, is that the Indian models are not doing best, right? So they should at least be on par with this Chinese model, but they're actually worse than the Chinese model.
And if I may add one point to the previous question on translation. So it also depends on, like, especially if you are using the translation in a particular domain, let's say mental health, then there are domain specific nuances which the model should get right. And you cannot generalize by looking at another model. We recently tried studying 5 languages: Arabic, Hindi, Bengali, Tigrinya, and Amharic. Tigrinya and Amharic are spoken in Ethiopia. Translating from English to these languages and vice versa. Actually English to these languages, clinical records, not mental health, but like general clinical records. And apparently doctors do use, especially in Middle East or US, where there are a lot of people from different places. So, and human translator may not be available always. So they quickly use Google Translate. So we evaluated 3-4 different translators, and we found that, for except for, I think, Hindi, where models were doing reasonably well, translators were doing reasonably well. In all other cases, to smaller or larger degree, there were severe risks. So for Amharic and Tigrinya, there were severe risks in many cases, like let's say the dosage being translated wrong. In Bengali, it was dosage and all were fine, but there were cases where the symptoms were translated in a very weird way that you will think it doesn't make sense. So, but in all languages other than Hindi, there were quite a bit of concern.
No, I'll just carry on what you said, and it is very puzzling that Indic LM is actually doing worse than a model. I mean, we would also have I'm sure they would also have data sets, access to data sets, which say people trained in Chinese labs would not have about India. I would hope so, or not so?
Not necessarily. Not necessarily. And I mean, if everybody is depending on the data on the web, right, then everyone has the same access to data, unless they go and make an effort to collect data, right? And most of these models, and this was last year's study, so we have to, the real proof of the pudding is the new models that will come out early next year, which are funded by the mission, right? Those are the real Indic models that are coming out. most of the models that were trained for Indic languages last year, the way that they did it is they took an open source model that already existed, like Llama or even Phi or whatever, and then they essentially fine-tuned it, and that fine-tuning process was done on translated data. So the fine-tuning data was taken from English data, it was fed through a translator into Indian languages, and then the model was tuned on that. So it didn't actually get any new Indic context because of that. It only got translated versions of English data. And so in a way you can, then you don't really expect those models to do that well, right? And the Quen model, for example, is a large, powerful model. It has seen probably a lot more data. It's, we don't know, I don't remember what size it was, but probably larger in size, used a lot of compute to train, etc., right? So that could explain why it was doing very well compared to the Indian ones. So I think the real evaluation, and that is what we are hoping to do with Samiksha once our benchmark is also completely formed, is once these Indic models that have got similar resources, right, have got similar compute and have had a lot of time now to do their own data collection and so on, right, how will they perform? Especially on a benchmark like Samiksha that has been built from the ground up for these different domains.
I had a question for all the three panelists, actually, if I may. And this is something that you referred to. Because of a combination of factors, one is the eval values have absolutely no real meaning for the true world right now. And let's take a very grounded example of automatic speech recognition. Let that be our example. So in the first talk, you said that, they are way inflated and the numbers do not reflect real world performance. Second, most funders as of today are rather not very happy giving a large amount of their grant for data collection because they believe that's a problem that's already been solved. So, I mean, how does one crack this? Because one is likely to be accused of, why are you reinventing the wheel? The models are already performing so well. Just take one of these, plug it in. You don't need to fine tune. You don't need to have your own model. So how does one, do that?
By doing good evaluations.
Okay, so do a audit and basically audit the existing models and release it out that it's not performing well enough?
Right, or have a good benchmark, right? And don't release it online, like so that people can't train on it and, show real values on that. I mean, those also will not be exactly what you will find in the clinical setting, but they will be closer than these artificial benchmarks.
My experience so far has been, and I know where Sunayana is coming from. So my experience has been people are not very averse to funding data collection projects as long as there is a very clear goal articulated. The situation might be slightly different in India. I totally agree there. But funders like Gates Foundation or Google, I have had good experience of, and you guys in Microsoft also, like they understand the value of data. And even the speech recognition example. So I think if I were a funder and you said that you want to build a better speech recognition system for all Indian languages and collect data in 35 Indian languages, current systems only do for 10, I would be a bit apprehensive funding it. But if you tell me that, okay, here is a particular application use case scenario which will help so many people, and I have shown, evaluated 10 different ASRs, this is the gap, and I want to bridge the gap, and for this is the data collection, then I'm more inclined to fund it. Yeah. So I think that end application part is very, very important as a convincing example.
I just want to come in here, Lekhangshan. This is obviously not related to to AI, but directly. But when we started collecting data on depression and anxiety in one particular state, we were asked which is the best tool, and we sort of said, looks like the PHQ-9 seems to be the best because it's there in all languages, etc., etc. And so we got that into the database, which itself is a huge step. Because in the health database to get mental health data in is not that simple, particularly not in the mental health ministry, but in the maternal health ministry. So we did that. We, started collecting data. We got only 5% of the population who came to a clinic. The data was available for, even that was a big number, but it was still 5%. And then it came down to 3%. So then we went back to the secretary in the state and said, look, I think we need to change our tool. We need to change it to a much more short tool and to validate it and to ensure that we are collecting the right kind of data. And they were very upset with us. They said, you are the experts, so why do you want to come back to the drawing board and recollect or introduce another tool? Don't you sort of, that reflects very badly on all of us, that we have to relook at the method of collecting data. But then we finally convinced them and we, continue to do funding and collect that data. But it's just that, even in sort of the real world, many times you have to go back to the drawing board when you find that something is not getting collected adequately. And I guess the same thing is true for when we feed data into the AI systems, that it's all about negotiation and constantly auditing and looking at what is coming out, is it meaningful, and then sort of, changing your game plan a little bit.
Okay, thank you so much. I would like to thank all of our panelists, all of our participants. I think this was an extremely interactive and very insightful session. That actually concludes the online segment of the final day of our workshop. Thank you to all of our delegates, all of our lived experience experts, a lot of engagement even online. Your insights and discussions on all 3 days have been invaluable to us, and I hope that we continue to talk about how AI can be more responsible and can get, its foot in to psychiatry and mental health per se. So we're going